42 years of health and happiness. অ্যাপোলো হাসপাতালের 42 বছরের দীর্ঘ যাত্রার গল্প। এই যাত্রাপথে অনেক ওঠা পড়া যেমন আছে, তেমনি একটা জিনিস নিশ্চিতভাবে রয়েছে যে কলকাতার তথা বাংলার এবং সারা দেশের স্বাস্থ্যক্ষেত্রে একটা বড় ভরসার নাম হয়ে উঠেছে এই অ্যাপোলো এবং নাম হয়ে রয়েছে 42 বছর ধরে। আর সেই উপলক্ষে চেন্নাই অ্যাপোলোর সিইও ডক্টর ইলানকুমারন কালীমূর্তি রয়েছেন কলকাতায়। আমরা কথা বলবো তার সঙ্গে এবং জেনে নেব কলকাতাকে কেন্দ্র করে অ্যাপোলোর বর্তমান এবং আগামী দিনের ভিশন ঠিক কি, ভিউ ঠিক কি, আমরা কলকাতার বাসিন্দারা ঠিক কতটা পরিষেবা পেতে চলেছি অ্যাপোলোর, বিশেষ করে অ্যাপোলো চেন্নাইয়ের সমান পরিষেবার কথা যদি আমরা বলি, কারণ বাংলা থেকে এখনো বহু রোগী অ্যাপোলো চেন্নাইতে যান চিকিৎসার জন্য, সফল হয়ে ফিরেও আসেন। সেই গোটা কোঅর্ডিনেশনটা আরো বেটার কিভাবে সম্ভব এবং কলকাতাতেই আরো এক্সপ্যানশন কিভাবে সম্ভব তাই নিয়ে আগামী দিনের ভিউ কি, সেটাই আমরা সরাসরি জেনে নেব সিইওর কাছ থেকে।
নমস্কার, দ্য ওয়ার্ল্ড আরোগ্যতে আমি তিয়াস এবং আজ আমি রয়েছি অপোলো হাসপাতালের 42 বছরের যে জার্নি তার উদযাপন, এবং সেই উপলক্ষে আজ আমার সঙ্গে রয়েছেন চেন্নাই অ্যাপোলোর সিইও ডক্টর ইলানকুমারন কালীমূর্তি। Welcome, sir. I'm the whole.
Thank you so much for being here.
Thank you, sir. So today we are talking about the coordination between Chennai, Kolkata, right? Because in Kolkata we receive all kinds of good treatments and all. Even though it might come better back than the coordination. Is it taking about a new blueprint of a new medical ecosystem for Bengal and Chennai?
Previously, even from Chennai, 30 years back, I'll say 40 years back, 130 years back, people used to travel to not work specifically in the business. So that's it. Some patient needs transportation. The service was not available in India, even in Chennai 20 years back. So whoever is affordable, they have to go to US, UK or Singapore to get those kind of surgeries. After 15 years now, no patient need to go abroad for any kind of treatment. Whether it's a transplant, the robotic surgeries, cancer therapy, everything is available in India. And Chennai is pioneering in this technology and bringing in the newer services. Again, the same thing will be applicable in Kolkata. I'm sure I am witnessing as a doctor, I am witnessing how the healthcare is significantly growing in Kolkata. Maybe 20 years back, many patients used to travel outside the state to get treatment. That number has significantly come down because the treatment options are available locally. How Apollo as a healthcare provider is helping development of local healthcare quality, there's a lot of ways. We train a lot of doctors, a lot of paramedicals, a lot of nurses in multiple units across Apollo group. They come back to Kolkata, they stay here and offer services to local population. That's one of the ways. We have also started hospitals. You will have noticed that Apollo is here. We're offering, bringing in a similar technology and all these things in the local hospital also. That's how we contribute, that how as Apollo hospitals helping the local healthcare to grow much bigger.
Right, sir. Here the time of traveling, the patient going from Kolkata to Chennai, that will be reduced and that will be real, and the golden hour sometimes it will save. So we can save more lives. Do you think so?
Definitely, I completely agree with that. See, the patients can come to Chennai only for chronic patients. If a patient needs treatment after a week, after 10 days, they can come. Say somebody's having heart attack, they can't travel to Chennai. They have to go to local hospitals.
Any emergency, like
any emergencies for that matter, pregnancy, any emergencies for that matter, 100% of the care and quality should be available locally. I'm pretty sure it's someday available. Yeah, I am talking about this kind of chronic conditions where maybe 3 to 5% of the diseases or conditions they have to travel somewhere to get treated. I'm sure in 5-10 years down the line, I can't tell the timelines, but those kind of services and expertise infrastructure will be available locally. The patient doesn't need to travel outside for any diseases for that matter. How Tamil Nadu has a state, has reached the state, I'm sure the West Bengal also will reach that state very soon. I'm very confident about that.
For further expansion and expertise growing in Kolkata, you were saying about for combining the team from Chennai and Kolkata together, you are aiming for a team studying in Kolkata, only with Kolkata doctors.
It's an expertise needed. I think the knowledge sharing will be always there within Apollo system. That's what we are good at. For example, some hospital needed some expert surgeons or medical doctor. I think we offer that service. We share the knowledge, we share the resources to any hospital in medical.
So like cross city excellence, what we say, cross city, that will happen. And what are the cost of transparency, sir? Because here we can use the local Shastro Shakti card, the local government health scheme, or we do have PM health scheme and all. Apollo will offer to take the cost and the cost transparency will be there.
So, say there are, you say there are 100 patients coming to Apollo from West Bengal. Not all of them are rich. Actually, majority of them are from middle class or below middle class. And I'm sure you would have also noticed that many of you always say friends will have counted. Not all of them are rich. And that's one of the mission of our chairman of the facility to improve accessibility and also the affordability. We offer many services at free of cost also. For example, heart surgeries in children being offered at free of cost for people from this region, including north and eastern region. We offer free of cost to NGO funding. Apollo also contributes in a big way. We have done thousands of complex heart surgeries for those people also. We are also partnering with many corporates and give a special pricing for the employees. Whole India, which is got millions of people looking for them or getting this kind of special pricing to serve their organization. Of course, there are certain schemes which is being offered by local government to local population. Unless service, we have that partnership with the government directly, we may not be able to offer the service. On top of the mind, I don't know which service, which scheme is available from which state, but actually we try to expand the scope of services to wider reach. With a huge disparity, even though there's a huge disparity in terms of affordability, we wanted to cater more people.
Right. While it's about expanding, when Apollo with expanding Kolkata more and more, will it reach to the grassroots like villages on far away places where people can't come to Kolkata always, come to the city always? But any scheme that Apollo can reach to them anyhow?
See, that should be the vision for the country. I think country is having a similar vision. I'm sure state government is also having a similar vision. Apollo itself will have the vision to reach more people at their footstep. Yeah, we need to figure it out when that can happen. We need to work on it.
Sir, the blueprint, you have the blueprint and expansion for wideness and all.
Yeah.
Is there any timeline or any time frame that after we can say, that we have reached there what we wanted for?
That exact timeline, I don't have access to the timeline. Maybe in our next meeting, I can talk about our future plans in West Bengal.
Okay.
But our goal is to serve the maximum number of people at their footstep. That's our ambition as well.
So the last question, Apollo is running 42 years, and that's why you are here. At 50 years, like 8 to 10 years after, where do you want to see the Apollo and what will be the legacy?
One of the vision, what we want to do is we wanted less number of patients coming to hospital
Okay.
by doing many things. One is preventive health. We are promoting more and more people to get regular health check so that they can identify the diseases very advanced. Yeah, and then get through that very early rather than coming to hospital at a later stage or spending a lot of money with the poor outcomes. I think that's one of our primary focus on preventive health. That's our primary focus right now. That's what Chairman repeatedly says, that preventive health is what, that's what we are currently focusing on. The second thing is bringing in the newer technologies, whatever is available across the world. If it thinks it's going to benefit the patient, whether profit comes or not, we always bring in this technology to our proton is a good example. Many people would have thought long back that why Apollo is investing so much of money in bringing a crores and crores of worth the machine to India. Chairman believed that if a patient from India wanted this treatment, I want to offer this. We didn't do the Excel sheet calculation on whether proton gives outcome or not. Now, many patients are benefiting out of this proton therapy. That's what we always do. Third thing is we wanted to reach to the maximum number of people in it, irrespective of their financial status and their first step. That's our third thing. It's like health, happiness at home. That's one of the mission of Apollo Excellence.
That's fantastic, sir, and fascinating, I must say. And thank you so much for your time, for your valuable opinion and all. Thank you. Thank you.
Thank you so much. Thank you.